Hello, my name is Janice Nichols. This is my patient, Brandon. I'm going to be doing the musculoskeletal assessment today and the neurological assessment. So I'm going to work my way down the body, and I'm going to palpate all of the joints for size, symmetry, make sure there's no bulges or masses, the skin overlying the joints and the muscles to make sure that skin folds are symmetric. The number of skin folds there are, also make sure there is no crepitus, tenderness, or swelling at any of the joints or muscles. So we'll start with the temporomandibular joint here. Any tenderness?
Nope.
Okay, and can you open and close your mouth for me? And then can you move your jaw from side to side? Perfect. Okay, I'm just gonna have you relax your jaw. Passive and active range of motion, no limitations. Now I'm going to push up on your jaw, and I want you to go ahead and push against it with your jaw. Perfect. Okay, strength is as expected. Now I'm going to move on to the cervical spine. Palpating, there's no bulges or masses. So now I'm going to have you move your head back to the back for me, and then chin to your chest. Okay, perfect. And then I'm going to have you turn your head side to side. And then turn your head to the left and to the right. Perfect. So no issues with active range of motion. You just go ahead and relax for me. I'm going to move your head. Any issues there? Any pain, tenderness?
Nope.
Okay, so now we're going to move on to the shoulders. So I'm palpating over the scapula and the shoulder joint here. Joints are symmetric, no bulges, masses. Okay, I'm gonna have you lift both of your arms forward for me. Okay, go ahead and put them down, and then to your back. Perfect, thank you. And then to your front, this way if you can. Perfect, thank you very much. And now I will do thoracic and lumbar spine. I will wait to do that until he stands up so I can also assess his gait and his posture. So I am going to move down his arm. I'm going to assess his elbows. Any tenderness?
Nope.
Okay, and there's no lumps, bumps, any crepitus, anything like that over the joint. So I'm going to go ahead and move you here, okay? Passive range of motion is intact. Okay, now I'm going to have you do the exact same thing for me. Perfect. And then can you, perfect, thank you. Now moving on to the wrists and hands, palpating all of the joints in the hands, making sure that there's no crepitus. There's no tenderness over any of the joints, no bulges, no masses. So I'm going to have you take your hands for me and just splay your fingers out like that. Okay, and then I'm going to have you bend like this for me. Okay, and then I'm going to have you put your thumb in. And then I'm just going to have you rotate your wrist like this for me. Perfect. So I'm going to skip for right now the thoracic and the lumbar spine until he stands. I am going to move on to his knee joints. Sorry. Any pain with palpation?
No.
Okay, so I'm going to have you fully extend your knee with your leg straight and then back as far as you can. Okay, and again with the other leg, please. Perfect. Okay. Now I'm going to move on to the ankles and toes. Sorry.
I can't help it.
Okay, so I'm going to have you flex your foot and pull it back towards you. Okay, try to rotate it outwards and inwards, and then just move it side to side. Okay, perfect. Same with the other one, out flexed, back towards you, towards the outside, towards the inside, and then back and forth for me. Okay, perfect. Okay, I'm going to have you stand up for me. So now I'm assessing his posture. As you can see, limbs are in alignment. Not like so now I'm just going to have you, I'm going to move this from behind you real quick. Okay, I just want you to bend over at the waist. Perfect, and back up. Okay, and then swivel at your hips for me, side to side. Okay, perfect. So thoracic and lumbar spine, intact, range of motion. I'm just feeling along the spine now for any lumps, bumps, masses, bulging areas, or crepitus. So now for your hips, this is a little difficult standing or sitting. But I'm going to have you rotate your leg out for me if you can. Perfect, and back in. Okay, and same with the other side. And back out. Perfect. So feeling over the hip area, the iliac crest. Everything is symmetric. Muscles are in good working order. Range of motion is intact and full range of motion passively and actively in all major joint groups. I'm going to put your seat back here for you. All right. Okay, so moving on to the neurologic exam. Sorry. Okay, so to test the first cranial nerve, which is the olfactory nerve, I'm going to have you close your eyes for me and tell me if you can identify the smell. Make sure I can identify it.
Grape. Is it closed?
I mean, it's purple. It's lavender, but it's nail polish remover.
No points. No points for that.
All right. Next, I'm going to test his optic nerve by standing just out of range here to do a Snell and eye chart for visual acuity. Oh, sorry. Can you cover your left eye, please?
XLCZ.
Perfect. And now go ahead and cover your right eye.
XLCZ.
Perfect. Thank you. So optic nerve, or cranial nerve 2 is intact. The next group of nerves that you test are 3, 4, and 6, which are oculomotor, trochlear, and abducens. So at this point, I can see in the light, pupils are equal, round, and reactive. I can see extraocular eye movements are intact. And go ahead and blink for me. And eyelid opening is also intact and voluntary. Okay, so next is the trigeminal nerve, nerve 5. So I'm going to do some light touch versus sharp touch on your face. But first I'm going to start with, go ahead and clench your teeth for me. So the masseter muscle and temporalis muscle are intact, and that has to do with the innervation of the trigeminal nerve when he clenches his teeth. So go ahead and close your eyes for me and tell me if what you feel is sharp or dull, okay?
Dull. Dull. Sharp. Sharp. Dull. Dull.
Perfect. Okay, so his trigeminal nerve is intact. Now to test the facial nerve, can I have you smile as big as you can, please? Okay, and then puff out your cheeks. And then purse your lips for me. Okay, so all of those movements show that that nerve is intact. The facial nerve, I'm sorry. So now I'm going to do the whisper test. I'm going to turn away, say a word to you, and you repeat it back to me. On this test, the acoustic nerve.
Peanut butter.
Perfect. Next is the glossopharyngeal and the vagus nerve. I am going to spare him from checking a gag reflex, but I am going to have him swallow. Go ahead. Any tenderness when you swallow?
Nope.
Okay, perfect. So his glossopharyngeal nerve is intact. Finally, I'm sorry, the spinal accessory nerve is the trapezius and the sternocleidomastoid. Go ahead and lift your shoulders for me. Perfect. So the spinal accessory nerve is intact, and then finally with the hypoglossal nerve, nerve number 12, cranial nerve number 12. Getting ahead of myself. So go ahead and stick your tongue out for me. Okay, and to the left and right. Perfect. So the hypoglossal nerve is intact. There's no deviation from midline when he initially sticks his tongue out, and he is able to move it from midline. Next, we are going to evaluate your coordination and fine motor skills. So I'm going to have you touch your nose and then touch my finger, okay? In rapid succession, I'm going to move my finger, okay?
Okay.
Okay, go ahead, touch your nose. Okay, perfect. And then what I want you to do here with both of your hands out, I want you to touch each finger to your thumb. Perfect. So his coordination and fine motor skills are intact. Now I'm going to have you stand. And this is the Romberg test. So I'm going to have you stand with your feet together, arms at your sides, and go ahead and close your eyes. Perfect. Okay, go ahead and open and go ahead and sit back down. So there was minimal swaying, which is to be expected with normal equilibrium, but he had a negative Romberg test, which tests his balance. Okay, sorry, I'm going to have you stand up one more time. This time, I'm going to have you walk off camera, and I am going to assess his gait. Go ahead. Okay, and come back. Okay, perfect. Gait is smooth, symmetrical, stride is even with each step, which is to be expected. Okay, go ahead and sit for me. We already tested primary sensory responses by testing light touch, which is the trigeminal nerve test. So I'm not going to repeat that. Now I'm going to test his perception of position. So I'm going to take your hand here, and I'm going to use your thumb, and I want you to close your eyes and then tell me which way I'm moving your joint, okay?
Okay. Down. Up. Back. Forward.
Perfect. Okay, other hand. Close your eyes, please.
Up. Down. Forward. Back.
Perfect. Now I am going to test his stereognosis. Go ahead and close your eyes for me. Can you put out one hand? Okay, I'm going to ask you to identify the object that I put in your hand, okay?
Okay. A pen.
Perfect, thank you. So there's no tactile agnosia. I'm going to have you close your eyes, and I want you to tell me if I'm touching you in 2 places or at 1, okay?
Okay. 1. 1. 2. 2. 2. 1. 1. 1. 2.
Perfect. So 2-point discrimination is as expected. Now I'm going to test his graphesthesia. I'm going to have you put your hand out for me. Just one, that's good. And close your eyes. I'm going to draw a letter in your hand, and you're going to tell me what it is, okay?
Okay.
I'm gonna try again. Your graphesthesia is not currently intact.
Hey.
Perfect. Thank you. I don't know if I should be worried about it or not. Okay, so now I'm going to have you close your eyes again. I'm going to touch you, and you're going to tell me where I am touching. Okay?
My right arm. Right leg. Left cheek. Right subscapular area. Left hand.
Perfect. That's enough out of you. Thank you. And now I'm going to test his superficial and deep tendon reflexes. I'm going to go ahead and skip over the abdominal reflexes since he's sitting right now. I am going to test his plantar reflex. I apologize in advance if he laughs. Freaking positive Babinsky's cute. I'm so sorry. All right. He's negative for Babinski's reflex. His plantar reflex is intact. Now I'm going to go ahead and do biceps, 45 degrees. Excuse my thumb. And then brachioradialis. Okay. That was the brachioradialis reflex. Now the triceps. Okay, tricep patellar. I'm just gonna hold your leg here. Okay, and then finally the Achilles. Okay, sorry, I'm also going to test quickly for ankle clonus. Let me do the work. Okay, no ankle clonus. So finally, I will have him lay down to do his abdominal reflexes. So for the upper two quadrants of the abdomen, I go up and away from the umbilicus, and for the lower two, I go down and away from the umbilicus. Okay, perfect. All right, so I believe that is everything. I appreciate your assistance in this video, and that's all. Thank you.